Assalamualaikum and good morning to everyone. Welcome to the Let's Solve the Problem. Our topic for today is all about weight problem, and we have three cases, which is two of them are patient with different issue with problem, and another one is the most popular health experts. Let's invite our three guests for today. Mr. Fazrul, how are you, Mr. Fazrul?
I'm fine, thank you.
Our second guest for today, Mr. Firdaus. How are you, Mr. Firdaus?
Alhamdulillah, I'm fine, thank you. Nice to be on the show.
And the one that we are waiting for, Mr. Faris, an expert from the most popular reality show, The Biggest Loser Malaysia. How are you, Mr. Faris?
Yeah, I'm good.
So, Mr. Fazrul, can you share a little bit about your background?
I'm 20 years old. I'm studying in UIA. I'm taking foundation in economics and management science. I have 4 siblings and I'm from KK.
So, what actually made you become an obese some time ago?
Well, all this started when I entered high school. I ate lots of junk food. Every day I will buy them or ask my parents to buy them for me.
Are there any other reason that make you become like this?
Yeah, I think stress also contributes to my obesity. As in my case, I really stress over my study. Whenever I get low grade, I will feel depressed. I feel like I'm disappointing my parents and my teachers.
So, what action to solve the problem and become normal person like others?
I talked to my parents about this, and thank God they managed to get an expert for me, which is Mr. Faris. He helped me a lot. He gave me advices how to lose weight, how to control my appetite, and I also have training with him 3 times a week within 3 months. So as you can see now, I have a wonderful result.
Oh, I agree with you. From what I can see right now, you have a wonderful healthy body, and I can bet that you you will take good care of yourself, and that you did not repeat the previous mistake.
Yeah, that's
Now,
for sure.
let's have a talk with our second guest for today, Mr. Firdaus. Before we discuss further, can you share a little bit about your background?
Okay. Hi everyone. I'm Firdaus and I'm 20 years old. And now I'm still single. I'm the second of 5 siblings. And I'm still studying for bachelor in ICT at UiTM.
It shows that both of you are students, but in different course, right?
Yes.
Okay. Can you tell us what kind of illness that you suffered for, and is that the problem really affect your life?
Oh, it's really bad. Long time ago, I'm an anorexic for 2 years. I know with this disease, the further I go, the harder to stop. But I never thought that this disease will nearly kill me, and it all started when I was 15. Can you imagine? For over a year, I'm only 50 pounds, and of course, it was underweight. So, one day, while I'm at the school, I fell into a hypoglycemic coma, and after that coma, I regained consciousness. So, I see the doctor and ask him about my problem. So, the doctor told me that in my case, I had an immediate chance to rehabilitate myself, or else I will disappear from this world.
What happened next?
Okay. So after I realized that I might die, the doctor kept me in the hospital with the feeding tube under my nose for about 3 months. Yeah, 3 months. Even though that I'm at the hospital, I still try to pull the tube out for my nose. So when the time I release to go home, I push myself to jogging around my house, but suddenly I collapsed for a second time in my life. And so at that time I felt like life was running away from me, life went out of me, and I know that that time I was dying, but Alhamdulillah, with all my family doa, I had survived an acute episode of heart failure. Yeah, that's all.
So, what action did you take to solve the problem and become normal person like others?
So, firstly, I went to get some advice from some counselor and expert like Mr. Faris. Then I just do it all their advice, like taking Herbalife, eating properly, start exercising, and lastly, I pray to God, I pray to Allah, and hoping for a miracle to happen. And yeah, Alhamdulillah, as you can see, I'm at your show.
Okay. Oh, I see. After hearing both of your stories, I'm interested to ask this question to Mr. Faris. So, Mr. Faris, what actually this problem is all about?
So basically we are talking about obesity and anorexia nervosa. So obesity is a condition in which the natural energy reserve is stored in the fatty tissue of human and other mammals. It increased to a point where it is associated with health condition and also increased mortality. Okay, the etymology of obesity is multifactorial. Overeating is the primary cause, but psychological problem, hormonal imbalance, and also eating disorder could all play a part. Okay, likewise, the treatment option for obesity is varied, including exercise and diet, psychological counseling, and also endocrine management. Okay, the most common cause for obesity is lack of exercise, overeating, hormonal problem, and also it could be genetic reason, and last but not least, for lifestyle.
Is there any explanation about this?
Okay, weighing too much could increase your risk by developing health problem. If your BMI indicate that you are overweight or obese, you may be at a risk to have health problem effect like diabetes, heart problem, stroke, high cholesterol, high blood pressure, and certain cancer.
What about anorexia? Can you brief more further about this?
Okay, anorexia is different problem with obesity. Anorexia is a complex eating disorder with three main keys. Okay, the first one, refusal in maintaining healthy body weight. Okay, the second one, an intense fear of gaining weight. And the last one is distorted with body image. Because of people dread of becoming fat, and they are afraid of becoming fat, and they are disgusted with their body look. So eating and mealtime could be very suffering for them. And yet what they can and cannot eat is practically all they can think about. Okay, unlike obesity, anorexia nervosa affect people in their whole body. For example, the brain nerve, it affect people where they cannot think right, they will feel sad, moody, and also they will have a bad memory. Okay, for heart, they will have a problem with low blood pressure, heart failure, and slow heart rate. Okay, for hormone, their menstruation will stop, and they also will lose bones. Okay, last but not least, the example is about the skin. Their skin will get yellow, have a dry skin, and also they will get bruised easily.
What is the step to prevent the obesity problem?
Okay, for obesity, ways that you can prevent it, the first one, you can have a simple exercise like you can climbing up the stairs instead of taking the lift, and drinking a lot of water, like 8 glass per day, because water can detoxify toxic in your body system. Okay, eat slowly and only when you are hungry, and last but not least, have a balanced diet.
What about anorexia? Do we have prevention to this problem?
Okay, for anorexia nervosa, steps that you can take to prevent it is very different from obesity, because anorexia nervosa is with your mentality. You cannot take yourself as a good judge for healthy body. You also cannot encourage your children to take a diet unless they are overweight, and also be confident with yourself, think positive, and last but not least, you also can seek for a therapist and also counselor.
Okay. Well, it is good explanation from our expert for today. It is clearly that all this problem we do have a prevention step, and that is sure that we need to avoid from this disease, because it may give problem and affect our life from negative situations. So I want to thank to all of you for spending your time, your free time with us. It's really helped us a lot. I'm afraid that we need to end our session for today. Right now, stay with us next week, and at the same channel and the same time in. So thank you.
Thank you.
Okay.